Good morning, good afternoon, and good evening, everyone. I'm so excited to be sharing with you a project that we've just finished piloting and are getting ready to scale up. This project is called Harnessing Knowledge, Elevating Learnings, Iowa's Experience Mitigating COVID-19. My name is Rima Afifi, and I'm the director of the University of Iowa College of Public Health Prevention Research Center for Rural Health, and we're partnering on this project with the Iowa Public Health Association. We're going to be using an innovative platform called the SenseMaker platform, and in this presentation, we'll show you how to access that platform and how to use it. So what is this project about? The objective of this pilot project is to deconstruct the COVID-19 response in the state of Iowa, and we want to do so to learn the lessons about effective actions that were taken and areas of needed improvement. A particular focus will be how COVID-19 affected and continues to affect population groups that are experiencing social or economic marginalization. And we're particularly interested in the social determinants of health that were and continue to be impacted by the crisis. We anticipate that this harnessing of knowledge, and again, we'll show you the platform and you'll get a sense of how the knowledge will be harnessed, will result in strategic planning and action to support communities in the continued response to COVID-19, but also to other crises. So why do we think this project is important? COVID-19 is a pandemic that came swiftly and impacted greatly. The impact of the COVID-19 pandemic was felt in every system, and all systems responded. People responded creatively, often in partnership, often with innovative action and out-of-the-box thinking. But the pandemic was and continues to be hard and challenging, demoralizing and draining, and harsh. You saw families, perhaps including your own, struggle. You experienced increases in morbidity and mortality in your communities. Working in public health was and continues to be challenging, but at the same time, so very meaningful. Many of you as individuals and within your organizations supported and are continuing to support your community to cope with this pandemic in multiple ways. Your experiences are important because they weave the story of the pandemic in Iowa. This project is uplifting those experiences and stories, the positive ones and the hard ones, so that we can understand better and document the richness of the response and learn together what tools, approaches, strategies, and reactions we should continue and which we can do better. This will guide the continued response to COVID-19, but also guide responses to similar future situations. We really hope that you join us in this discovery. So what is the SenseMaker platform? And this comes right off of their website. SenseMaker enables the capture of the experiences from real people when they matter most. With SenseMaker, you're able to see broadly, visualizing patterns across the narrative of wide and diverse populations. SenseMaker is the world's first crowdsourcing method for human judgment, meaning, and feeling. Everyone's voice deserves to have an impact, and SenseMaker offers a science-based approach to guide collective impact and leverage the strengths of being human in uncertain times. We're going to be presenting the results of the pilot of this project, the pilot part of this project, excuse me, I'm not finding my words, at the Public Health Conference of Iowa. And you'll be able to see how we can visualize patterns across the various narratives that we were provided in the pilot project. So how does this work? What I'm going to do now is take us to our project site and show you a little bit what it looks like and what the types of questions that are going to be asked are. All right, so I will click on this, and then I'm going to stop sharing and share the screen of the platform. All right, so when you click on the link that you will receive as part of an email, you'll get to this page. And this first page has the project title and then has a little summary of what we're going to be asking you to do. So basically the main part of this project is you're sharing a story that meant a lot to you in response to a prompt, and I'll show you the prompt in a little while. And then answer a bunch of questions related to the story. So we'll both have the story and can do a thematic analysis of the themes that come out of those stories. And we'll have some quantitative analysis related to responses of all those that join us in this project in relation to the stories that they tell. And we anticipate that every story and answering the questions related to it will take about 15 to 20 minutes to complete. So once you read that, if you agree to participate, you click on I agree below. And if you don't want to participate, you can close the page. So I'm going to go ahead and agree so that we can continue to see what will show up. All right. So the first prompt is this one. Imagine that you're trying to explain to somebody who does not work in public health how our public health system responded to the COVID-19 pandemic in Iowa. What story comes to mind from your own experience that you would share to show what happened? So you go ahead here and you start to share a story. So I'm going to input, I was able to help a community member access vaccination. And of course, your story would be much longer if you were, if you were writing it. But I'm just trying to get us through the system to show you a little bit what the system is. We also have the option, if you don't want to write a story, to actually record the story. So you would just click on this yellow button, and you can just record for as long as you want the story that you want to tell in relation to this prompt. If you were to give the story a short title, what would it be? So I could say vaccination, or whatever you choose the short title to be in relation to your story. And then we ask if you are willing for your entry to be shared anonymously, word for word, as an example for others to read and to make sense of based on their own experience, or if you would rather just share your journal entry with a team of researchers or analysts working with the data. Now, if you choose to share your entry, it does remain anonymous in that it is not linked to you or anything that's identifying about you. It's just the word-for-word story that you share. So I'm going to go ahead and check on this. And what happens after that is that we will be asking a bunch of questions that are in triads and a bunch of questions that are in dyads related to the story that you just shared. So I'm going to go ahead and show you the triads. And in the program, it'll give you an example to just remind you what to do with the triads. So this first one is just an example triad. And you always get a prompt. So this one's yesterday I spent my time. And it gives you three options: sleeping, leisure, or working. So the triads all have particular statements at each of the corners, and you're basically responding to the prompt in relation to your story and moving that little hexagon around depending on what your answer to the triad is. So let's take an example, all right? So in the experience I described, in this particular triad, the three corners are: I had control over the action, I was able to act, or the ability to act was out of my control. Okay, so you had total control over the action, and it could be you had control and you were able to act, or you had control, but the ability to act was out of your control, or it can be somewhere between I was able to act and the action was out of my control. All right, so you're trying to give us a sense of what you think related to the project that you shared. So this is a little hexagon that you move around. And if you feel, let's say that I felt that my story, in the experience I described, I both had some control over the action and I was able to act. And I had more control than I was able to act, so I might put the hexagon up here. If I felt like the ability to act was completely out of my control, I would put the hexagon all the way over in the corner. So depending on the three corners of the triad, you move the hexagon around related to how you feel the experience or the story is in relation to the prompt, okay? If it is sort of midpoint between the three statements in the triangle, then you would put it in the middle. The second one is the experience I described was influenced by social, cultural, and economic factors, political decisions, or the way that things are done around here. And let's say I think really that the experience I described was really influenced by all these things. So I would put this hexagon right in the middle. So there are 7 of these triads. And just in the interest of time, I'm going to do not applicable so that I can show you what else is in this particular platform. So after the triads, you get to dyads. And the dyads are very similar and they're still related to the story that you told, but you basically move the hexagon around a sliding scale between 2 endpoints. So for example, and we have, I believe, 5 of these dyads. So in the experience I described, I or the public health professional, because you could be telling a story about some other public health professional, used tried and tested approaches or took a risk on something new. So if it was something in between, I mean, some of the approaches were tried and tested and some of them were risky and new, you would put the hexagon right in the middle. If in fact, in the experience you described, we only used tried and tested approaches, then we would put it all the way at the end. And so the dyads are just moving the hexagon along this sliding scale. All right. And again, in the interest of time, I'm just going to put not applicable, or I prefer not to respond. And of course, that's always a choice that you can make on any one of these questions as well. So once you've answered the 7 triads and the 5 dyads, you click on the arrow and you go to a page that has a bunch of multiple choice questions still related to the particular story that you're telling. So how did you feel about the experience you shared? So let's say very positive. And then, picking 3 emotions that describe your feeling about the story. And there are a few other multiple choice questions, 2 other ones related to the particular story that you told. And then you click on the arrow again, and you get to a page where now you're no longer being asked about the story specifically, but about your general response to the pandemic. So what feelings best describe your current emotional status related to the pandemic's impact on your work in public health? You're able to pick up to 3, maybe frustration, up to 3 emotional states. And then it asks what your feelings were at the height of the pandemic in winter 2020 or spring 2021. So how are you feeling now? And how were you feeling at the height of the pandemic? And then it asks how uncertain you were at the height of the pandemic about your own safety, the safety of your family, and the safety of your community. And then it'll ask just a few sociodemographics about you. These are not identifying because we expect to get up to 500 stories. And you can always, of course, choose I prefer not to answer. The last few questions are optional, and they ask you to imagine a new but equally virulent pandemic and to sort of give a sense of what you would do differently at that time, to share an insight you had about the impact of the pandemic in your local community, and to share how this process of thinking about the pandemic made you feel. And once you're done, you click on, you can either click go back if you want to change something about the story, or you click save. I'm not going to click save now because it would share, this story, which is just fictional because I was using it to show you the platform. Once you save, you can also choose to submit another story either at the right away or at a later time, or just, share that one story. All right, I'm going to stop sharing screen here. And I'm going to go back to the PowerPoint. All right. So we really hope that you join us in this project. Our hope is to engage a wide range of public health professionals in sharing stories of their experiences in the pandemic, the challenges, the facilitators, the growths, and the struggles. And if you're interested in taking part, watch your inbox in the next month for an email invite from the Iowa Public Health Association with information and a link to the platform. And you follow that link to submit a story and answer a few questions. And as I've said, we think it'll take about 15 to 20 minutes for each story. And we are providing incentives, which are a t-shirt and the ability to participate in a drawing for like a gift card. We also hope that you share the link with others who you think would be interested in sharing their stories about the pandemic. We really look forward to hearing from you so that we can collectively understand the impact of COVID-19 in the state of Iowa and uplift the amazing work that you've been doing throughout this time. Thanks so much.